Welcome to the Fabulous 50s and Beyond. I'm Jim Pollard, your co-host with my wife Janetta, and today we're going to be talking about an important event coming up soon. It's the Purchase Area Mental Health and Aging Conference. Our guest today is Marilyn Ingram. You stay tuned and we'll be right back.
And he'd say go with what you got. Start from where you are. Give it your best shot. Keep reaching for that star. Get in the race, keep your own pace, keep moving and never stop. Just go, go with what you got.
Welcome back. As I said, our guest today is Marilyn Ingram. We're going to be talking about an event that we try to feature every year. We've actually been to the conference and taped and some of the different speakers and different things. But this is an important event in Western Kentucky, isn't it, Marilyn?
Yes, it is. We've done this conference several years, and we generally have several attendees that come each year.
And it covers all of Western Kentucky, right?
Yes, we are the purchase area, so we do cover the western counties of the state.
And it's going to be at the Worship Center again this year.
Yes, out Gospel Mission at exit 16.
And what are the dates this year?
It's going to be May 23rd. It's on a Wednesday, and registration starts at 8 that morning, and then we should wrap up around 4 that afternoon.
Around 4. And go ahead.
Can you pre-register?
Yes, you absolutely can. And if anyone would like to get a hold of me, I would be glad to send them a registration form. I can do that either by mail or email. And they can contact me at 270-442-6168, or they can email me at mingram@extendicare.com.
Okay, and since you're going to, we will actually, that is the program and registration certificate in front of you, right?
That is, yes.
Well, since you're going to send me a digital file on it, we'll actually put the registration slip up on our website also, where they can just copy it and send it to you, or call you and send it to you. And our website is thefabulous50s.net. So we'll have that up on the website also, and we'll have the program and everything. You've pretty well got the program wrapped up, don't you?
We do. We've just got a few things that we're firming up. We've got some ideas. Some the speakers we're still working with, trying to secure, but we've pretty much got the total program wrapped up.
What is the theme this year?
The theme is weaving a good life.
And how do we weave a good life?
Well, we've got lots of ways you can weave a good life. We're going to start out the conference this year. We've got a local man, Richard Henson from the Broom. He's a motivational speaker, a humorist, and a storyteller and an author. And he has made brooms that have actually been on Dr. Quinn, Medicine Woman. And he talks about from 25 cents to here, it's the story of a broom man. So he's going to kick off our conference this year, and so we're looking real forward to hearing him. And the fact that he is fairly local, you know, should be very interesting to people.
His shop is in Simsonia.
Yeah, he's actually our neighbor.
He's your neighbor, okay.
He's in Simsonia.
He's in Simsonia,
yeah.
right. So, and he's got a website too that, you know, people can go on and look at and kind of see what he's going to be talking about. But he should be very entertaining.
And he's an interesting man. I mean, his brooms have been a lot of places. You know, the story of his brooms is quite unique within itself.
Right, so yeah, we're looking forward to that. And then we've got Roxanne Ferguson is going to be talking about quilting. She's an award-winning quilter. And the way the conference is set up, we have an opening speaker that everybody listens to. And then we have choices. Well, in the morning we'll have 3 different speakers, and you can choose which speaker you would like to hear. So we've got Roxanne Ferguson, who is an award-winning quilter, will be talking about quilting for fun and stress relief. Because, you know, this is, we're looking at healthy issues too with this. She should, that should be very enjoyable. And then we got Brandy Trice, who's a registered pharmacist. Brandy's working out at Kmart now as a pharmacist, and she's going to be talking about medication interactions. And I'm sure there'll be a question and answer section there that people can, you know, ask her questions about. And then we're going to have someone come in from the hospitalist program. Both of the hospitals have started using hospitalists, and lots of times when people are admitted to the hospital, they don't have their own physician. So there's a group of doctors hired by the hospital. And so we're going to have someone come in and explain exactly how that program works. And so we're not sure exactly which speaker that will be. And that's our first session of the morning.
That's going to be interesting, because due to my recent emergency room entrance into the hospital, and my family physician was not practicing at the hospital where I went in, I guess I had what they call a hospitalist to take over my care.
We just didn't know
While
what
I was
it
there,
was.
we just didn't know what
Right.
it was. We thought he was like a house doctor, and I guess that's,
And that's
what
kind
they
of
are.
what it is in a way. And so we're all going to learn more about that program because, like I said, both hospitals are doing that now. Because some physicians go only to a certain hospital, and
Right.
lots of times people don't have their own doctor.
Right.
But that's the first time I'd heard that word.
Yeah,
Yes.
yeah. It's
Hospitalist.
a new terminology, I guess.
Right.
Yeah. Well, I was very pleased with mine. I just want you to know
Okay,
that.
great. We're glad
Yeah,
to hear
yeah,
that.
that's good. And so the quilting, drug interaction, and hospitalist,
Right. That's our first
they're all
sessions.
three very interesting sounding
Right. It's going to be
sessions.
tough to decide
Yeah.
which one you want to
Yeah.
attend.
They don't flip in the afternoon, do they?
No, we don't have any repeats
Okay.
the afternoon.
But you know, a lot of people, the older we get, I guess, the more confused we get. When you have so much medication, I mean, he's on more medication now than he's ever been in his life.
That's true. And lots of times you go to different doctors and you don't always, one doctor may not realize what another doctor has put you on. So it's very important to make sure that all your physicians and your pharmacists, and you get all your scripts filled at the same place so they can make sure that none of your medications are interacting. And then sometimes they interact with different foods.
Oh, yeah.
Yeah.
Or they're just allergic to them, which was what his case was. He
Right.
was allergic to what he took. And it was,
I make sure when I go, I take a list of what I'm on, so that they can see it.
Oh, absolutely. Yeah.
Yeah.
Carry it in your wallet so if you
Yeah.
get admitted to the hospital, you can pull it right out and show them what you're
Yeah.
taking.
Yeah.
That's
very
a good
important.
idea.
And are we going to have a noon speaker like we usually do?
We do. We've got another morning session.
Oh,
So,
okay.
and so the second session in the morning, that's from 11 to 11:50. Our sessions are about 50 minutes each. And Dr. Kenneth Brown, who is a pastor here in Paducah, he also is a volunteer with the Red Cross, and he's going to talk about psychological first aid. You know, lots of times we prepare for disasters physically, but after something happens, we need to make sure that we're mentally,
Right.
prepared, and then we are taking care of mentally on these types of things. And then we're looking, we don't have our speaker firmed up yet for strokes, but we're looking for, in touch with the physician about talking about strokes, warning signs, and prevention. Because lots of times when people are having strokes, they don't even realize what's going on until it's too late.
Right.
And then our third speaker that morning is Angela Stanton. And Angela is a registered nurse and also a massage therapist. But and she's a director of nursing over at Green Acres Nursing Home in Mayfield. But she has a special drumming technique that she uses for Alzheimer's patients. A lot of times Alzheimer's patients get very agitated, and this is something that she's going to be able to show us how to do to use it to calm patients. You know, lots of times people have Alzheimer's patients in the home, or they are lots of times in long-term nursing homes. And so that should be very interesting.
Okay, I need to ask about the terminology drumming.
Well, I think it's tapping with fingers in a way.
Okay.
Yeah, we're not
On
we're
their
not
body
playing.
or?
Yes, I think on the body is the way I
Well,
understand
see,
it.
I've heard of tapping.
Right. Okay.
Of that
Yeah.
treatment modality. There's a lot of that on the internet.
Right.
Well, because I subscribe to a lot of the natural healing and different ones, and tapping is kind of a natural healing process of massage therapy. And there's one big site that talks about that a lot. As the tapping process. So that's the term that I was familiar with.
Okay, and I'm sure it's similar. I've not seen this presentation, but I'm sure that it would be similar.
Yeah.
Yeah. We're not playing drums. We're actually
Right, yeah,
doing it too.
tapping.
It's a calming effect for
Yeah.
Alzheimer's patients.
Yeah. Well, that's like I've seen different things where children are. I don't want to say ADDH, but there's another terminology that where if they put their hand, they may not can hear a radio, but if they put their hand on the speaker, the vibrations will calm them down.
Right.
And the waves and things like that will calm them. And which it's always interesting to see that. Of course, totally off of this subject here, one of the things that I'm fascinated with is the use of iPads with children who have trouble learning or expressing themselves today. What are the kids that we talk about that came through in the wheelchair?
I know what you're talking about.
Senior moment.
Well over 50.
Yeah.
Yeah, but that they can't talk, they can't get, but their mind is functioning. But
Right.
now they're using these iPads that they can express themselves.
Right. They can touch and it
They
will
can
speak
touch
for them,
and,
I
and,
guess.
and they can put it in and it can be, and they can do it. And I'm fascinated. Autistic children.
Okay.
I'm fascinated how that they're using iPads in their treatment now and the success they're having with it.
Right.
And
Yeah.
so
Technology is amazing, isn't it?
it is, you know, and it really is. But I mean, these are great topics that I see that we've got coming up this year. And like you say, it will be hard to choose where you want to go
Right.
and to see them. And of course, they always have a good lunch.
We do. So Delia Restaurant always caters our lunch, and it is always delicious. And lunch is included in the registration. So
right.
How much is the registration fee?
for seniors, it's $10. And there's sponsorships are available for seniors through the Purchase Area Development District office. And so a lot of seniors come, but they don't have to pay anything at all. And not only do they get lunch, they get breakfast too, and then and an afternoon snack. But we offer CEUs for nurses and social workers, which is awesome. So, and the cost for that is $35. And I know I have to get continuing education units each year, and for 5 CEUs, $35 is awesome. That's a great price.
Is it 5 this year?
We should get 5 continuing education units for social workers and nurses, LPNs and RNs.
That's interesting. I went to a conference one time that we featured here and signed up and did all the paperwork and everything. And wasn't too long, they sent me 3 CEUs. And then I just sent them
You weren't expecting them?
No.
Yeah.
But everything has, all your professions now have continuing education, don't they?
Right, they do.
And so this is a good way to get 5 of them.
Things change so much and so fast. As you said, technology, it's just, if you don't keep up, you know.
Right.
Then you're
Yes.
just in trouble, really.
Right. We do need continuing education because you're right, things are constantly changing. I know in my line of work, when I started out working in nursing homes 35 years ago, things are completely different than what they used to be.
Oh, and the paperwork is horrendous, I'm sure.
It is. Lots of paperwork.
You know, they talk about getting rid of paperwork with computers.
Yeah.
No, it's just horrendous. I know, and I've been going to a lot of doctors the last few weeks, and the doctors spend more time on the computers than they do on the talking to the patient. I mean, they're looking at that computer punching because everybody's going to them.
Right.
I guess they're required by law now, aren't they?
Right. Electronic
They
medical
have
records
to.
are going to be required here soon. So
Yeah.
that's the wave of the future.
And
But when you print it all out, you've got more paperwork than you did before.
I know.
If you can look at it on the computer screen, you're fine. You're saving
Yeah.
paper.
I know that one of my doctors, he still would come in the hospital room, he'd sit down, write out and everything, and then he'd go back and do it later.
Probably
you know.
let his girls do it.
Yeah, probably have his girls do it. But I'm really impressed with the programs that y'all got lined up this year. They really sound good. And we always look forward to going. We've covered this for years and been to most of the conferences that they've had, and I'm really impressed with it. Well, we're about out of time for our first session, believe it or not.
Wow,
And,
that goes fast.
oh,
doesn't
it does. Well, you know, you're giving us a lot of good information here, and information that I'm sure our people are interested in having. So you stay tuned, and we'll be right back.
Travel advisories to small business loans, retirement savings to Medicare coverage, ID theft protection to contacting elected officials, student loans to taxes online. Whether you have information to get or ideas to give, USA.gov is the official place to connect with your government. From surplus car auctions to finding a new job, our new mobile apps will keep you updated on the go. So, from marriage records to passport applications, veterans benefits to birth certificates, patent applications to energy-saving ideas, product recalls to home buying tips. Check out USA.gov, because the country runs better when we stay connected.
Welcome back to the Fabulous 50s and Beyond. Our guest today is Marilyn Ingram, and we're talking about the Purchase Area Mental Health and Aging Conference. The conference is going to be, the dates again?
May 23rd.
May 23rd at the Gospel
Mission
Worship Center. And that's in Reedland, off of exit 16?
That's right.
Off of exit 16. And it starts about 8 o'clock in the morning with a little continental breakfast or snack there. And this is a conference that we're excited about because we've featured it and we've been there, we've taped speeches, and we're always excited to be a part of this conference. And great topics this year, Marilyn. And we're going to get right, well, let's talk, we didn't discuss who's going to be the luncheon speaker.
Okay, for lunchtime, we're going to have Scott McGee, who's the anchor at WPSD, going to talk about schemes and ripoffs. And Scott's always, right on top of all the latest schemes and ripoffs and has a lot of valuable information there.
Right.
Lots of times the targets for schemes and ripoffs are our seniors.
Oh, yes.
Because they just trust people. They believe you if you say, they're going to come and fix your roof or your driveway, and then they take their money and they're gone.
Absolutely.
And that's sad.
It sure is.
It's really
There's so much
sad.
of that going on, and a lot of it on the internet. If any of them are on the internet, they can get taken pretty easy if they're not careful.
Right.
And I know years ago, when it first came out, the Nigerian
Lottery?
lottery or something like that. It wasn't a lottery, it was as much as it was something else. I almost got taken. In fact, I went to an attorney and asked him about it. He says, "Oh, you haven't heard about that?" And I said, "No." He said, "Get as far away from it as you can." And and I always thought I was pretty up on what was going around.
Right.
But we get all this IRS stuff, and we get all this stuff. I get phishing, as they call it, every day. I get some of it, Yahoo, PayPal, all these different things where they're trying to get your ID, your personal information. And boy, once they get it, they can really do damage.
Oh, absolutely. And I've heard people are get a hold of, they're hacking into your email and say that people are stranded in a foreign country trying to get money.
Right.
But I think mostly it would not be younger people who would fall for that. It would be older people. And
right, because they want to help. They have that helping attitude, and they think somebody's in trouble. It's just natural to help.
And sometimes they're the ones that has the money that can do it.
Absolutely. And then sometimes they don't have the money and they get taken for everything they have.
Right, and that's sad.
Even
a lot of
sadder.
times there's nothing they can do because these things come from foreign countries, and
right, there's no way to
we
track
have
them.
no.
All right, second half.
Okay, well, we're going to do a little exercise at lunch too, Jim.
Yeah, they did that last year.
Yeah,
Zumba.
we're going to get you up and moving. Yeah, this year we're going to have Serena Dickerson with Full Body Fitness. And so she's going to get us moving for a few minutes before we go back into the sessions. After we eat that good Sedalia lunch, we need to get up and moving a little bit.
Right.
You're right. And then that afternoon, our three choices are Clay Campbell. Clay, runs the Kentucky Opry, and he's, of course, written the book, but he's going to talk about staying active as a senior. He does a lot of trips for seniors, and is just going to talk about things in general for seniors to do. And then we're going to have Denise Woolley from the McCracken County Extension Office. She's going to talk about healthy eating on a budget and how to cook for 1 to 2 people. Lots of times you've raised a family of several children, then you find yourself at home either by yourself or just you and your spouse, and you kind of have to learn how to recook again and in smaller amounts. And then also a lot of seniors are on fixed incomes, and they need to be able to eat healthy on the income that they have, and so she's going to help us out with some ideas on that.
Yeah, we run into that problem every now and then. She'll cook like she used to, And I say, next time just cook half as much.
Right.
You know,
You get tired of those leftovers, don't you?
I do.
Don't mention it.
But yes, and that is a problem, you know. I mean, she's a great cook, and she just used to, and then we could eat it for 3 days, you know.
Right. Yeah.
But you know, I don't care what they say is wrong with you. The cure is always partially exercise and eating properly. It doesn't seem to matter what, you know, you can
You're right,
be a
Janelle.
diabetic or you can be this or that, but
Yeah,
Those are the
exercise
two
and,
bottom
and
lines.
healthy diet are very important.
Yeah.
right.
So, and then our last speaker for the afternoon, or choice on the afternoon session, is Gretchen Ruth. And she works down at the Four Rivers Behavioral Health. And she's going to be talking about some mental health issues. And one of those topics that she will be covering is hoarding. We see a lot of that on TV now, you know, the buried alive and people that are hoarding. And so that will be one of the issues.
That's getting to be a big thing, of course, with reality TV. I don't watch reality TV, but they've got hoarding reality TV shows now and everything they're talking about.
But I saw one day on TV, and you could just, you had to, you know, you couldn't walk down the aisle. This is her house, but you had to get on your knees and go through these little tunnels to get anywhere in the house. And
Right. And usually people, I think, have a mental illness and they feel like they have got to save, you know, maybe they've gone through some lean times and they just want to, you know, keep things, and there's kind of usually a reason behind that. They really have a hard time letting go of items, and, you know, they just collecting things. So we probably have more of that in this area than we would like to think about, because I think, you know, that goes on lots of times and people are not aware of it until maybe social services goes in.
Would she be talking about some of the programs that they have available?
I'm sure she probably will be talking about some of the things they have down at Four Rivers. They have a lot of services down there.
Is this the same Four Rivers that does different programs for testing and things, or is this the one downtown Broadway?
The one downtown Broadway.
Okay, so it's a different clinic.
Right.
Yeah, yeah,
That does,
yeah.
Right. They deal with mental health issues
Yeah,
mainly
okay, right.
down there.
Well, the reason I say that because I know that the Four Rivers Clinic, I guess it is, they have
Yeah.
a lot of
Right. They
programs
do
that-
the clinical research.
clinical research, and they actually have some different programs going on now that seniors can qualify for. Now, a lot of times the programs lock off at 65, but I know they've got one in diabetes going on right now. They've got one on Alzheimer's going on, where they do take people over 65 for. Because being a type 2 diabetic, I know that's a problem today, and
Right.
that's one of the things that they've got going on. And so that's was that the second afternoon session?
Right. Well, in the afternoon we have just one session, then we have a closing speaker.
Okay.
And then Clay Campbell is actually going to close us. You know, he's going to talk earlier about staying active, but then he's going to give us a motivational speech to close us.
Okay.
Clay goes out and does some speaking too, and he's very interesting. I know I go up to the Kentucky Opry some and always enjoy his shows and enjoy hearing him talk. And, you know, like I said, he's written an interesting book, and so he'll have some things to share with us that afternoon.
Yeah, Clay's an interesting person. I've been up there. We've done his show two or three times ourselves. We've been on his show, and it's a fun place. And we enjoy going up there ourselves also.
Right, that's a lot of fun.
So again, it's May
23rd.
23rd at the Gospel Mission.
Registration starts at 8 a.m.
Okay.
And you do need to pre-register, so we can plan on how many and make sure we got plenty of fried chicken for lunch, because that's important.
Right.
But we need about a week in advance. And that's great that you're going to put the registration information up on your website, Jim.
I'll
We
just
appreciate
put it
that.
up where they can get that off the website. And again, our website is thefabulous50s.net. You have to put the in it. Thefabulous50s. 50s is spelled out. .net. I'm sure he's putting a board up right now to show you what it is. But we're excited about the conference again this year. Any other thing to kind of wrap it up that you might want to talk about?
Of course, we always have a lot of vendors come out and set up tables, and you can learn about different businesses in town that are usually related to seniors and health. And they always have giveaways. Everybody loves free things, so there are lots of giveaways that you can pick up.
I get all my sticky notes and my pens and markers and stuff at the mental health conference.
Right. They get set up for a year.
It's okay if you mention the sponsors, because sponsors are very important to put a conference on like this.
Okay, well, let me tell you who our sponsors are. Of course, we have the Purchase Area Development District, who where we all work out of, and then Morningside Assisted Living, Medco Center of Paducah, and Green Acres Healthcare. They're actually we're all sponsoring lunch. Then we got Parkview Nursing and Rehab Center. We have Christian Care Center in Catawba, Intrepid USA Home Health Services, Oakview Nursing and Rehabilitation Services, and the Legacy Personal Care Center. And of course, Gospel Mission, we couldn't do it without them letting us use their facilities. And then West Kentucky Community and Technical College. They are a great help in getting the continuing education units. We work with Nancy Turner out of the nursing program, and she's a great help with that. And then we've got a new sponsor this year, and that's Woodlawn, Maple Lawn, and Mayfield Memorial Gardens.
Okay. Well, that's good, you know, because I realize that sponsors are very important.
Absolutely.
You know, we couldn't have a lot of these conferences if we didn't have the sponsors.
Right.
Basically what I'm asking. Marilyn, you've given us a wealth of information this time, and I really appreciate you being here today and sharing all this information with us. And we want to encourage our people to pre-register. Like I say, information will be on our website, and we'll have links to other sites there that will be important. And we just want you to be able to pre-register and go to this conference. You know, and I can't think, most of the time we've had pretty decent weather when we've had these also.
Well, we have.
You know, I can think of one day we had rain, but most of the time it's been pretty nice, and that makes it easy to get out and go, and we want to encourage you to be there. We also want to remind you that we're here every week, and we want to remind you that we'll be doing different shows about different things. We have a lot of exciting guests lined up for the future, and we just want you to watch our show each and every week. We also remind you that we are streamed online. If you have a friend who lives anywhere in the world that you would like to tell about one of our shows, you can go to our website, thefabulous50s.net, and they can click on our shows and see our shows or get the information. A lot of the information that we give out is available in all parts of the United States, and so we encourage you to take advantage of that. And we just we're glad that you watched our show today, and remember now, use it or lose it.
Can't see as well as I used to. Can't run as far or as fast. Sometimes I think that the old me is becoming exactly that. But when I start thinking of all I don't have, that's when I tell poor me Beethoven was 50 and deaf as a post when he wrote his Ninth Symphony. And he'd say, go with what you got. Start from where you are. Give it your best shot. Keep reaching for that star.